The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
It's been almost 4 years since the National Inquiry into Missing and Murdered Indigenous Women and Girls released its final report. Tonight we'll find out what's happened since and whether members of Parliament's recent acknowledgement of a national emergency will help. Then, what some of the people and families marking Community Living Month want you to know about supporting those with intellectual and developmental disabilities. It's Tuesday, May 16th, and that's ahead on The Agenda. Earlier this month, the House of Commons unanimously backed a motion to declare the deaths and disappearances of hundreds of Indigenous women, girls, and Two-Spirited people a Canada-wide emergency. It also pledged to fund a public alert system for use going forward in such cases. And for a growing number of advocates, there is a push to recognize that such terrible events have also claimed too many Indigenous men and boys. With us now for more, we welcome, in Thunder Bay, Ontario, Cora Maguire-Siret, Chief Executive Officer of the Ontario Native Women's Association. In Sault Ste. Marie, Ontario, Paulette Steeves, Canada Research Chair in Healing and Reconciliation at Algoma University. In Blind River, Ontario, Grand Council Chief of the Anishinaabeg Nation, Reginald Niganabe. And in Oswego, Ontario, near Brantford, Sandra Montour, Executive Director of the Ganok Wasra Family Assault Support Services. And we're very pleased to have all four of you on our program tonight to take a look at a hugely disturbing and important subject. And I'm going to start by just putting some facts out here for our viewers and listeners to consider. Here we go. Sheldon, put this graphic up if you would. We're going to take a look at Statistics Canada's latest numbers on the victimization of Indigenous people across the country. The data suggests that Indigenous people are twice as likely as their non-Indigenous counterparts to be the victims of violent crimes such as sexual assault or robbery. In 2020, police reported a total of 201 Indigenous homicide victims. The homicide rate involving an Indigenous victim reached its highest level since 2015, and the increase was mainly due to a higher number of murdered Indigenous men than in previous years. Let's do some more here. Despite a decline in the homicide rate among Indigenous women, the rate was still nearly twice that of non-Indigenous men and more than 5 times that of non-Indigenous women. 47% of Indigenous women aged 15 and older who were murdered between the years 2015 and 2020 were killed by an intimate partner. And murdered Indigenous women were twice as likely as Indigenous men to have been reported missing. All right, let's get into this. It's been 4 years since the federal government accepted the findings of the National Inquiry into Murdered and Missing Indigenous Women. How much progress has there been in terms of responding to the calls for justice issued in that final report? Let's go around on that. Cora, you want to get us started, please?
Yeah, sure, definitely. I think when we're looking at this, implementation has been slow. There's no doubt about that. When we're looking at the crisis that's happening out of Winnipeg and how there's Indigenous women in a landfill site because of the lack of response to their deaths, I think this is really showing that this is a systemic issue here in Canada, and we need immediate investments now. So when we're looking at, Leah Grisans and her call for action, this is another tool that we can use to address this violence. And because this violence is so complex, as you can see from some of the data, is not, Indigenous women are more likely to be murdered by, serial killers, by intimate partners, by families, by non-Indigenous people, by Indigenous. It's a very complex issue that we're facing. So we need immediate investments now into Indigenous women's safety.
Chief Niganabe, how do you see the progress as it has happened so far?
The progress is very slow moving. I mean, even right now, the 124 million that was announced in the federal budget for the missing and murdered Indigenous women, Two-Spirited plus. There's no date on when these will be, as far as I know, there's no date on when these funds will be distributed or how they'll be distributed or anything along these lines. Everything's just progressing very slowly, moving way too slow for what's taking place right now.
Paulette Steeves, what's your read on it?
Well, I agree with everyone. And, I would expect to see the homicide rate go down quite a bit if the National Action Plan had been implemented. But from what I've seen reading the 2022 report, there is no implementation plan. So these are great thoughts, they're great words. People have done a lot of work, but the federal government has not come up with an implementation plan to address violence. In the meantime, our people are dying, on a daily and weekly basis. This is far too slow. And I really agree with Leah Gantz. We definitely need a red dress system for Canada.
We're going to get to that red dress system in a little bit, but let's first get Sandra Montour on the record as to how she sees the progress, if any, made so far.
I think it's slow. I think I agree with everybody else. It's too slow. People our women, our families continue to be murdered at unacceptable rates. And I believe Canada is moving at a snail's pace, and this is a very serious problem. And I give a lot of credit to the families who continue to advocate for change. They continue to have that strong desire that they want to honor their lost family member by wanting to ensure that no other family goes through this trauma. I can't help but think of the resources and shelters that have been sent back to the federal government. That's completely unacceptable. The fact that they're sending money back to the federal government and taking it away from our shelters, especially because I'm thinking specifically of the northern communities, the northern remote communities who could benefit so much from having a shelter or a transitional house. And those women and those children have to leave their territory and go and move to access safety, to feel safe. We're not moving fast enough.
Paulette, let me get you to react to something that I mentioned in the introduction to the segment, the notion that the House of Commons unanimously, how often does that happen? They passed a motion in early May calling on the feds to declare the ongoing violence against missing and murdered Indigenous women, girls, two-spirited people, quote, a national emergency. It hasn't happened yet. Give the federal government some advice on this. What should they do?
The federal government, they worked on this National Action Plan. There were 7 main goals. These were great goals. But what is that without implementation? And I'm very happy to see the MPs pushing for this, pushing for action to be taken. But if the federal government was serious about healing and reconciliation, about creating paths for healing, our MPs wouldn't have had to do this, right? The federal government is showing that they're not willing, and they really need to think about that.
Cora, can I get you to follow up by answering this aspect of the question? It would be one thing for the federal government to declare this situation a national emergency. What that would actually mean is another question. Do you think it would change anything if they were to do that?
I think every action is going to make change. When you're looking at, systems are failing to protect Indigenous women ultimately at the end of the day, and Indigenous women want action. What we also need to look at is a coordinated strategy of safety. So that's really what that national response needs to look like, is being able to coordinate Indigenous women's safety all across Canada. And when we're talking about violence against Indigenous women, we're not saying that, addressing violence against us is an end point, it's a beginning point. As we can see from the data that's happening with our brothers, violence against us continues to be perpetuated here. The violence is different, and the violence against Indigenous women is a systemic failure. And that's what we really have to start to address and unpack and invest into Indigenous women's safety, because any community that's safe for Indigenous women is going to be safe for anybody.
I mean, Grand Council Chief, that's really the question. If the government, in its wisdom, did decide to sign on to this unanimous resolution of the House of Commons and declare a national emergency, how much confidence do you have that it would actually lead to concrete action that you want to see?
As was stated before, any action is a lot more than what's going on and what's happening right now. any of it would be appreciated. Of course, we'd have to bring in provinces and all of the Indigenous organizations that are out here to help coordinate. But there are plenty of ideas, plenty of solutions within the Anishinaabe Nation, and I'm sure within several of these organizations that are represented here today. And then I imagine there's many more countrywide. So any movement would be great movement, and a lot of work could get done.
Okay. Sandra, you referenced the red dress alert earlier, and I think for people who don't know what that is, you should tell us, number one, what it is, and number two, whether you think it would be the right way to go here.
Well, I imagine Cora could probably speak on that a little bit better than I, but I've actually had more questions when it comes to, you know, the things that I've been reading about the red dress alert. Certainly, some of the I would like to think that it would be somewhat similar to the Amber Alert system. However, we'd have to work out some serious jurisdictional issues between federal and provincial issues, because our women, we go from, you know, on reserve into the cities, into, you know, rural, remote. We're all over the place, all over Turtle Island. So we would definitely need some sort of coordinated system. Do I believe that it would be helpful? I would hope so. It's something. I do need to say here that I do think that Canada has a responsibility to make amends for some of our past injustices. So for all of our past injustices, you know, our people are still dealing with, I mean, those statistics that you cited at the beginning, our people are still dealing with the effects of colonization, oppression, our women, our children, and our men. I'm glad to hear that you're talking about our men, because it's our families all around that have been impacted tremendously. And it comes from the past injustices of our people.
Okay, Cora, let's pass the microphone to you and tell us how do you think a potential red dress alert system could work?
Yeah, I think it's like the biggest piece is recognizing that violence doesn't know jurisdictional bounds, just like Sandy was speaking to, that, you know, we as Indigenous people, we know some of us live in our own home communities, we live in urban centers, rural, and violence doesn't know those jurisdictional bounds. And so looking at a coordinated alert system on the cell phones, just as Sandy spoke to about having, when the child goes missing, being able to have that system there, but it can also collect the data. And I know you were able to reference some really good data earlier. We still don't have that comprehensive review of, you know, how many missing persons cases there is historically and continuing, because the outcomes are different. And that's really what we're seeing, that, you know, when a Indigenous woman or a girl goes missing, there's a connection to potential human trafficking, for instance, and the outcomes are not working well. Like when you're looking at the domestic violence, family violence that's happening, why that data is key is because we can really do outcomes for prevention there. Because when there's domestic violence happening or family violence, you know, we need to have a safety plan. We need shelters for women in order to prevent these deaths, because we've seen how investments into non-Indigenous women and their systems have decreased the violence against them. And that's why we need to see investments into Indigenous women.
Grand Council Chief, I want to follow up with you on, well, let me put it this way. It is obviously understandable that much of the focus has been on murdered or missing women and girls, Indigenous women and girls, because the numbers are so disproportionate to their share of the population. But there has been a growing recognition as well, as we mentioned in the opening, that murdered and missing Indigenous men and boys is an issue as well, and their numbers are disproportionate to their percentage of the population. Do you think they have been lost in the shuffle as we try to understand this phenomenon better?
I don't think so. I think we've always been aware of it, and we're been definitely paying attention to it. I just don't think it's perhaps it's not talked about as much. But we do recognize that Indigenous people in general are being missing and murdered. So it's, I mean, one for all of us. It impacts all of us, irregardless of if it's men, women, or children, or elders. It impacts the community in a deep and profound way. But like you said, the numbers are high for missing and murdered Indigenous women, so therefore that's the focus for us right now.
Right. Paulette, how about you on that issue of murdered and missing Indigenous men and boys, which has got less attention? Should it have more?
Yes, it should have more, and really what what the government and these agencies should be really paying attention to is how high the statistics are and the difference from the general population. And it's very diverse, the communities that Indigenous people live in now, and we need the services and the action in all of these communities.
All right, Cora, can I get you to speak to the issue of whether or not you think, I mean, we had a very thorough and long investigation into murdered and missing Indigenous women and girls. Do we need a separate inquiry into murdered or missing Indigenous men and boys? What's your view on that?
I think what we need is action. We can have inquiry after inquiry. We've had so many different reports, so much research done, and we need to build on those recommendations. So when you're looking at, the Truth and Reconciliation Commission, you're looking at, the RCAP, like there's so many different reports that have been done for generations and so many actions that haven't been acted upon. At the end of the day, that's what we need action now. And many of the recommendations within the National Inquiry will help support healing with our men as well, and looking at addressing the violence. Because really what we're talking about is systemic racism and discrimination here in Canada. And systems are failing Indigenous people at the end of the day. And, that's the difficult part about this. A lot of people want to think that it's, kind of one bad person doing one bad thing to one, Indigenous person. But ultimately, it's systemic failure when you really look at the stories, when you're looking at families and what they've said, and how systems have failed everywhere from, the healthcare system to the justice system. There's no justice in the justice system when it comes to Indigenous people. And so ultimately what we're looking for is long-term sustainable investments into our communities, into our healing, and into our safety.
Chief Niganabe, I should give you a chance to comment on that as well. Do you think we need a separate inquiry for murdered and missing Indigenous men and boys?
No, she said it perfectly and eloquently. It doesn't need, we need action, not more inquiries.
Gotcha. Okay. Okay, this may be obvious on the face of it, but I still think it's worth exploring here. Sandra Montour, can you talk to us about the differences between how Indigenous men and women experience violence in this country today?
Well, we have a shelter here at Six Nations, the Noquesha Family Assault Support Services, and we do provide services, and we always have to our men in our community. What we see here is, especially during the pandemic, we've seen an increase in violence amongst our women. The violence is more severe. It's more life-threatening. The violence was always severe, but it's even more severe, and it is more life-threatening since the pandemic, and that's what we've seen as a result of the pandemic. We also see too that the violence is more, Cora said it, there's domestic violence, relationship violence, whereas with the men, what we see here is the violence is more about family violence. Perhaps it's a family member or a community member against a male in the community. So that's how we see it. We do see a difference in the violence, but certainly the outcome is the same. There's been such tragic death in our community, and we've seen it across the board. And you cited those statistics at the beginning. So, our men are dying as well. And I'd like to answer that too regarding I agree with Cora and with others that we need action. We need for the government to listen to the communities. We know what we need, rather than wasting the money to do another huge inquiry. We need, ask the community what we need, ask the communities how we can help, and put those resources to our communities, because we know what we need. We know how to make change in our communities. And I can't help but think of the Family Wellbeing Program, Indigenous Healing and Wellness Strategies. We have examples that have worked really well for Indigenous people.
Paulette, do you think that the communities are not being adequately consulted by the federal government? They have not been asked what they want?
Well, I think that the communities have been included in discussions, but that doesn't account for anything if there is no action. What we really need is action. And, the federal government and people also need to realize that, yes, there is an enormous rate of violence against Indigenous men and women. And it's the families and the children now we also need to talk about. How do we deal with and care for children that have suffered the loss, of a family member to violence? There is no treatment center for Indigenous people for PSDT, for healing and recovering from historical and ongoing colonization. This violence is still ongoing. It's ongoing in so many areas. And, in the National Action Plan, one of the things they really highlight is education for the general population, trauma-informed courses and classes. There's a few out there. They're not accessible to people. And when you go in, my experience is when you go in to teach these classes to, say, a police force, you face pushback in your own community. So there's violence in so many different areas, but one of my concerns has been for the lack of care, the lack of facilities for Indigenous men and women, and specifically for Indigenous children and families dealing with trauma. There just are no facilities.
Chief Niganabe, I'd like to circle back to a comment that Sandra made about the pandemic making things worse. And maybe you could report to us on how things were with your Anishinaabeg Nation. Did the pandemic have a significant deleterious effect on the amount of violence in your community, for example?
It did have a greater impact, and we're seeing effects of that now. We have gang violence and other things that are taking place within our communities to some small degree, and it could be scattered out to different communities. We do represent 39 communities, so it's different in everywhere. But going back to kind of what was mentioned earlier about asking the First Nations, or the First Nations kind of saying what they need, a lot of our First Nations have been saying they need greater police, not just presence, but also respect for their First Nation laws, and that's not happening right now. It's been an ongoing conversation with both the federal and provincial governments for years now at this time, and no action has been taken on that. So First Nations aren't in control of, their First Nations at all in any regard, especially in law enforcement. So there's a problem and a gap right there that's identified easily.
Let me follow up with you and just make sure I understand what you're saying. Are you saying you would want to see a greater RCMP police presence in your communities, or a greater respect by RCMP of your police services?
There's a gap in police services for First Nations. We do have like Anishinaabeg Police Services, or some of our other First Nations have agreements with the OPP or anything like that. We don't have RCMP here in Ontario, so that's not part of the problem. But the part of the problem is that whether it be OPP or our own Anishinaabeg Police Services, there's a gap in the funding. Both Ontario and Canada can agree to a set amount on who will pay. And then the First Nation might enact laws that they would like to see happen here on their First Nations, but they're not allowed to. It won't be recognized by the Ontario courts. So there's that gap in policing and law enforcement and prosecution.
Gotcha. Cora, I should give you a chance to speak to the issue of how the pandemic has either changed and or made things worse as it relates to this subject today. What's your experience with that?
Oh, it's just been like, crisis on top of a crisis, compounding traumas that have happened. And, even though we're an association, we also deliver a lot of frontline services all across Ontario. And we had seen that it wasn't safe to be home for many people. And the level of increased racism and discrimination happened at the level of violence. And we also have to look at the pandemic has created the mental health and addiction crisis that we're seeing. We're seeing far too many parents having to bury their children, and we're losing so many, of our community members to this mental health and addiction crisis. And because like Paulette, who had spoken to, there is no healing services, no treatment, and it's so true, because what we're seeing on the ground right now, post-pandemic, is that if you want to access the treatment services, it's going to take you 1 to 2 years to be on a wait list. And if you can wait 1 to 2 years, sorry, you don't need treatment. So what's happening in between is the gap in the justice system that our Grand Chief was just speaking about, on how, what's happening is while people are waiting for treatment, they're either ending up being killed, murdered, or ending up in the justice system. And because there is no response that's preventative, and there is no capital investment. So, largely what we're seeing is we need to build safe spaces for our own healing, built by Indigenous people for Indigenous people. And so we need to be able to build these capital projects, and yet there is no capital funding available to provide these healing spaces, these healing services. And that's something that we need to see kind of post residential school, post colonization, is investments into our communities. And, there has been no comprehensive healing across all of our communities, from our First Nations to our urban Indigenous, First Nation, Métis, and Inuit. And so we really do need to see investments into our healing designed, developed by us, for us.
And Chief Niganabe, when cases end up in the court system of Canada, do you think, they talk about clearance rates, the ability of law enforcement, the ability of the justice system to get justice and clear cases in an expeditious fashion. Is that happening adequately in your community?
No, not at this time. I don't feel it is. It's the system in general, the way it is set up. Not a lot of it works very well for First Nations. And I'd like to say, before anybody says, well, just demanding more money isn't the proper way, it would help only because we've been socially and economically stymied for so many years now. We're just trying to catch up.
Well, let's go around our virtual table here and just get each of you to put an idea forward. You've all called for the federal government to take more action. You've all said we don't need more studies, we need more action. So let's get some ideas going forward here on one thing. Each of you give me one thing that the federal government could do tomorrow to make some progress on these issues. Sandra, you want to start us off?
Well, I always think that funding, providing funding for sustainable funding, not these project fundings. They can perhaps all these projects that they're offering, they can look at making them more long-term, evergreen, sustainable, rather than project funded. That our people don't like that when, they just get started in something for a year, 2 years, 3 years, and it's starting to, they start to reap the benefits of the project, and then it's over. And that causes more trauma and more mistrust than anything. So, and that's very frustrating. So that's really what I would like to see for our First Nations is long-term sustainable funding.
Gotcha.
Yeah.
Paulette Steeves, how about you?
Yeah, I think the federal government needs to, have more discussions and think about what is the half-life of intergenerational trauma, and how can we shorten that, in part by providing centers for healing and care for people and communities affected by the trauma of ongoing and historical colonization. So try to get into a healing center today. I've tried to help a number of Indigenous people that have suffered from sexual abuse and violence and have been diagnosed with PTSD. There is no treatment center they can get into. There's a private one. If you have $10,000, you can get maybe a week or two there. And, for Indigenous people, those kinds of services do not exist. So I'd like to see the federal government fund spaces in existing facilities for healing, specifically for Indigenous people, while they work to create with communities the healing centers that we need.
Gotcha. That's a good concrete suggestion. Okay. Cora Maguire-Surrett, how about you?
Yeah, I agree with everything that's been said so far, and looking at that community development approach to the investments, particularly around, if you want to look at what is one thing that we can do today to help support our grandchildren's grandchildren of tomorrow, is those investments into those safe, supportive healing spaces in community. And we can't have that if we don't have access to capital, because ultimately, at the end of the day, it's going to take us as Indigenous people to do a lot of the heavy lifting and a lot of the heavy work. And Indigenous women need access to that safe space. And, that means investments into capital. And we should have safe spaces in every single one of our communities all across Canada.
Chief Niganabe, give the last word to you on this.
Sure. Other than everything that was already said, which is absolutely much needed. I mean, right now you could even do the red dress alert system. We had the anti-network helpline here in Ontario too. At one point, a lot of this helps, connect people with the supports they need, and it's usually staffed by Indigenous women or Two-Spirit LGBTQ plus people, which have the ability to, connect with the individuals. But also too, I mean, start implementing any of the thousands of recommendations that you have in any of the reports that you have that have been done on Indigenous people since the start of everything.
The roadmap is there, Grand Council Chief. It does make you wonder why it's taken so long to implement. What do you come back with when you think about that?
The desire not to give up the colonial structure or power.
So that
would mean dismantling a lot.
That might be required at the top of the list. I want to thank the four of you for joining us on the agenda tonight. Cora Maguire-Surrett, Paulette Steeves, Reginald Niganabe, Grand Council Chief of the Anishinaabe Nation, Sandra Montour. It's really good of you to share your views with us here on TVO, and we appreciate your time very much. Be well, you four.
Miigwech.
Steve.
Miigwech.
Bamapi.
Over the past many years, there's been a growing recognition that people of different abilities require different supports. We've covered some of that through the lens of the Accessibility for Ontarians with Disabilities Act. Tonight, we're going to talk about the challenges faced by those with intellectual and developmental disabilities who often require lifelong support of family and other caregivers. So let's welcome Chris Beasley. He is Chief Executive Officer and Board Secretary of Community Living Ontario. Martikwa Lamkin, Registered Social Worker and Disability Lead at Become Resilient Individuals Counseling Services. She's also a professor at George Brown College. And Sherry Caldwell, co-founder and director of the Ontario Disability Coalition. And it's great to have you three with us here for this discussion tonight here on TVO. Sherry, to you first. How do developmental and intellectual disabilities, generally speaking, present themselves?
Developmental disabilities are very diverse. My daughter was born and immediately needed lots of care. They can have physical disabilities, intellectual, behavioral, social. It's very diverse. They usually present in childhood.
Well, let's talk about your daughter, Ashley. Right?
Yeah.
Okay. How old is she now?
Ashley just turned 18.
18. So describe her for us.
So Ashley is a sweet, bright young lady. She needs a wheelchair. She has a physical disability and a walker to get around. She communicates with AAC. She also
she communicates with
augmentative communication.
Oh, okay.
So she uses an iPad to communicate. Communication is challenging. She needs help with daily living and even has a G-tube for feeding. So she requires a lot of support to function in the world. She loves high school, but it's a very shortened day. There's a lot of support needed, and unfortunately not enough out there.
Okay. Marty, what are some of the incorrect assumptions that people living with developmental disabilities have to face in Ontario?
Yeah, there's several of them, and those biases and attitudinal perceptions come from, ableism. So this idea that they're incapable, right? This idea that they're inferior, this idea that they're even kind of just less worthy of their own dignity and their own rights. And so we see that idea that therefore we need a cure or a helping professional to come in and to help these people because they're not able to kind of function. So it's some of those ideologies that we see in the way we deliver our services and our care. And really, we want to work from a strengths-based perspective, which means that everybody has challenges in life, everybody has strengths in lives, and we want to highlight those strengths as opposed to working from a deficit model. What's wrong with this person or what's their limitations? So.
I totally appreciate where you're coming from on that, but the reality is these are people who need more help. Isn't that fair to say?
Of course, but that help should not be what kind of labels or stereotypes them in a specific way, because we all do need help in different ways. That's just part of the human condition, right? So yes, there are going to be individuals who require additional support, but we should not stigmatize or label them because of that and treat them differently because of that.
Gotcha. Chris, Ontario's Ombudsman recently launched an investigation into cases with people with developmental disabilities who are stuck in hospitals. How do families in distress end up in this situation?
Well, I think you said the word distress. I think that's the key point here, where you have families who are in crisis, who are in distress, and you will take any port in a storm, and so people will be placed in a hospital, and hospital is for people who are ill, not simply because you have a developmental or intellectual disability, and yet they end up languishing there for months and sometimes even years, and then sometimes transferred to a long-term care facility. So we know about people in their 20s, 30s, 40s who are in nursing homes.
And should not be there?
And should not be there. They're there for the only reason that there's a lack of capacity and a lack of our will to support them as a society.
Marty, the Ombudsman also said that vulnerable people are, quote, often kept in restraints and their condition deteriorates. Yes. Okay, what are they doing in a hospital in the first place under restraint if that's not the place where they ought to be?
So it's very common that medications are going to be used to sedate folks, right? So again, you're out of your typical environment, whether they're used to their homes or their day programs. You're in a hospital setting. During the pandemic, again, it was very difficult for parents to interact with their families. So that was a huge challenge. And so it's not uncommon that medications are used to kind of sedate patients, to make them sleep, to make them feel drowsy, because again, the hospital is not an appropriate place for them to be residing in. It's in a kind of an acute care, healthcare setting, right?
And even for any of us on our best day, we're probably anxious if we find ourselves in a hospital environment and don't know when we're going to leave and don't know what's going to happen next, and maybe can't communicate with the people who are around us. And all due respect to the medical profession, they're doing the best they can, but when faced with situations where they're not properly qualified to support people, then what could possibly go wrong, right? And when you talk about medication or behaviors, as they're often talked about, it's people are trying to communicate. They're trying to let their wills and preference be known in an environment where they have no control, they have no power, they have no options. So of course there's going to could be behaviors and then you see restraints, and it's a vicious circle.
Sherry, you wanted to say?
I feel like we have to think of why they're ending up in the hospital in the first place. It's because of lack of home care and supports in the home, or supportive housing, or group homes, or financial support to go into day programs, or support to participate in the community. There's a bit of an institutionalized mindset within the government that people, even you see it for seniors, building so many long-term care homes, but people with adults with disabilities, even seniors, want to be at home and in their communities, but we need support to do that.
And there's not enough home care?
No, there's not enough home care.
Well, okay, can we use Ashley as an example here? Okay, you've mentioned that Ashley needs a wheelchair to get around. Do you get, what support do you get from the people of Ontario to help with Ashley's care?
Ashley has nursing care that visits her at school, and she has a little bit of nursing and PSW at home. She's lucky. I'm well equipped to advocate on her behalf, but many families aren't so skilled in navigating the system, and also families that need more care or just in different regions don't have access. So they're not funding nurses enough, or nurse wages in the public sector. The raises, they have to give them a raise. They need wage parity, because nurses are leaving for higher salaries at hospitals, at long-term care homes.
How much does a wheelchair cost?
My daughter actually just got a new one, and it was over $8,000.
Did you get some help with that?
We had help through Easter Seals, but parents under 18 have to fund 25% of your child's wheelchair or any assistive devices, and then if you can look to Easter Seals for that. But they're having trouble even to keep up with all of that need.
But Easter Seals, that's a private organization, right?
It's a charity.
Yeah. So the Ministry of Community and Social Services does not help out with this?
They help out 75%, but they expect families. If you're really have a lower income below $70,000, then they'll give you another program called Assistance for Children with Severe Disabilities.
And what if you're past 18 then?
And past 18, they actually do 100% fund. They're not leaning on the families for the equipment as much, but it's limited the number of the equipment that they will cover. So they'll cover wheelchairs, they'll cover walkers. They won't cover ramps into your home. They won't cover a special seat for the toilet, a bath chair. There's many, many things that are not covered under the assistive device program.
Well, Chris, let's talk money here. What essentially, how does the current funding model work in the province of Ontario, whereby if you need some help, here's what the province can do for you?
Right. So first they'll look at your condition, if we can say, your disability. They'll assess if you're qualified, and then if you do qualify for support, then they assess the level of support that you will need. And once they have an idea of what that looks like, then currently it goes into this black hole of a priority list where only the most needy will come to the top of that list. So in essence, we operate in crisis mode all the time. So if you do have a stable home environment and you're lucky enough to have parents and a roof over your head, then you're not likely to get to the top of that list anytime soon. And that's talking about more sort of residential support. Where do you want to live and how do you want to live? They're working on a funding formula now that says how much will each person get and what is the sort of the funding entity that will look at that. But that's still a few years away, and so we don't actually know right now how the funding actually gets arrived at.
Are people, again, I don't know if condition is the right word, but help me with the vocabulary here. When I describe people who have, do you say a condition?
I say folks who are living with intellectual disabilities, developmental disabilities.
Perfect.
Yeah.
Are they eligible for Ontario disability support programs?
They are, but again, that also is quite limited. Right? So there's kind of a shelter component, a basic needs component, and it's quite limited in what you can access. So again, it's not the only resolution. Oh, great, we have Ontario Disability Supports, ODSP, that's it. No, as Sherry was stating, there really needs to be an accumulation of supports to really wrap around families.
Would a guaranteed annual income or a basic income, as it was once called, how would that change this?
I still don't think it would be enough. The dollar amount is not what we're just only talking about in terms of somebody's fullness to participate in their communities, right, and their wellness. So we really have to look at kind of community participation supports, what programs are available, how do we remove barriers and access to care, and also how do we disseminate the information. As a registered social worker, a lot of my role has been working with families who simply just don't know. The information is very complex, the information is not very clear at all, and I've also worked with parents who have developmental disabilities themselves. So I've also worked with several mothers. I've done a lot of advocacy through, Child Welfare Society, things like that, where the parent themselves has an intellectual disability.
The parent and the child?
Exactly.
Yikes, how do they deal with all that?
So there, again, you need a lot of wraparound support. So when you're receiving, intake documentations to even apply for ODSP, for example, I really have to break that down. I have to use visuals. I have to kind of recreate some of that documentation to adapt it to meet the needs of the parents. And that's another area also that isn't really looked at or considered.
Sherry, forgive the simplistic way I'm going to ask this question, but if you have more intellectual disabilities, or if you have more physical disabilities, do you get more money from the government?
No, unfortunately not. With the passport program, they will assess you and give you a bit more money, but it's not enough to meet the needs. And then if, like for instance, if my daughter needed to go to a day program and participate, and they're going to charge her more. So if you don't need, if you need one-to-one support, it could cost triple the amount. So it's just insufficient. And right now they're putting families on $5,500 a year. So when you finish school and you're 21, that'll give you 2 hours of care a week. So families, if you're lucky to be able to go to work before your child finishes school, you're going to have to leave work as soon as they graduate. And we know in Ontario with inflation and the cost of living, Parents can't. People need income. They need food on the table. Families are in crisis.
Okay. Again, I don't know if this is the best way to ask the question, but do you, Marty, do you need more or do you need a revolution here? In other words, more of the existing, or is the existing just not the right way to approach this and we should start a revolution and start from scratch? What do we do?
Yeah, I think that's such a great question. I'm all about revolutionist kind of mentalities and ideas. I think the landscape has changed. I think people's needs have changed. Our society has changed. So I really think we need to start with families. We need to start with the individuals. As much as I'm really privileged to be on this space, I do not identify with an intellectual disability. So I recognize the privilege I'm even taking up to talk on this topic. But we really need to hear directly from the families what they're experiencing, what their lived realities are like. And the proof is kind of out there. Families are telling us, I need A, B, C, and D. The challenge is the government is not responding.
What's A, B, C, and D? What does that constitute?
Funding, additional supports, culturally appropriate support. So a huge part of my advocacy is around how anti-Black racism is also a part of the developmental service sector, and how Black families, for instance, when Sherry is talking about the importance of advocacy, when sometimes Black families are advocating, that is seen as them being aggressive, angry, disruptive. And so we get stereotyped in particular ways that create additional barriers to accessing services.
Actually, before we started this discussion, you were telling me how if you're a Black teenager who's autistic and you're walking down the street with a hoodie on,
exactly.
What?
Right? Who's that dangerous person, or who's that, mysterious person in my neighborhood? And I've developed a program called Racism Affects Me Too to work with adults with intellectual disabilities to teach them about anti-Black racism, because I found that there wasn't anybody really doing that work, especially following the death and the murder of George Floyd, where I had Black folks on the spectrum saying, Marty, could that happen to me? Could that be me? And so, again, they are going to be seen as Black youth and under those kind of racial stereotypes before they are seen as having an intellectual disability.
Chris, do we need a revolution?
I think that it's tempting, because obviously we need a lot of wholesale change, but I also worry about people and families who currently rely on supports, because some do get what they need or are happy with the supports, and so you don't want to pull the rug out from under them, which a revolution could do. So I think the government right now has an initiative called Journey to Belonging, and it's going to run through this decade. And it's looking at transforming how services and supports are delivered, and more person-centered, person-directed, more direct and individualized funding.
Is the right approach to take, in your view?
I think it is. Yeah, I think it says all the right things. Obviously, the proof is in the pudding. As we move down that track, and as it gets implemented, then we'll see. But I think it's a good framework from which to start.
Journey to Belonging.
Right.
Where do you want to see that end up?
So I would like to see it, again, as Marty points out, it has to start with the person, has to start with whoever's around them, whether that's family, friends, neighbors, community. How are they supported? And then how do we provide those supports in a way that's appropriate in terms of the need and the amount? And then for people to live typical lives in their community. How might we, imagine that, and how can we create a vision for each person to live their best life with the right amount of support that each person requires? Because everybody's different. Everybody at this table is different. Everybody who has a disability is different.
16 million Ontarians? How many people do you think we're talking about here trying to help?
How many people have an intellectual disability in Ontario? We estimate about 100,000. That specifically identify as having an intellectual disability. It's possible. We can do it. We just need the will.
Yeah, as a percentage of the population, it's actually not that much.
Exactly.
Right. Do we need a revolution here, Sherry?
I feel we need big change, in that Ontario is way behind. When you look to other countries, like in Australia, they started their national disability insurance strategy in 2010, and there are ways into it, and it's really improved the lives for people with disabilities.
How so?
They have more control over their funding, over their supports. they have a direct funded model that puts the power back into the people with disabilities and their families to get the resources they need. So some people there have access to accessible vehicles. Right now, families here, like it's unaffordable to purchase a new van and then to add another $30,000 to make it accessible so that you could actually get out of your home and participate in the community. But it also helps them hire workers. It gives them more control. And right now, families are just falling into these gigantic cracks in the system.
Can I ask you about Ashley? When you want to take Ashley out for something, and she needs a wheelchair to get around,
Yep.
how do you travel with her?
Well, we're lucky. We have a van. We can put the wheelchair in the car and take her out, but that's a privilege that we have. It's just not affordable for many people with physical disabilities to afford a van. My daughter's school is having a track meet, and there's not enough buses for all the kids to get to the track meet. So I'm able to take her there, but some of the other kids in the class aren't going, right? So the school's going to adapt. They're going to do something for them there. But these kids need, like the province needs to help support families in many, many ways. Like programs and nurses, cars. I could go on, but it's just a vast, like people are just suffering because of it, and these kids can't participate in the community, these adults either.
Right. OPSEU, the Ontario Public Servants Employees Union, is the union, I guess, involved in a lot of the work that all of you do. This is from a report that the union submitted to the provincial government back in 2021 related to some of the issues that we've been talking about here. And Mr. Director, Sheldon, would you bring this up, please? And I'll read along for those listening on podcast. The agency service model has been the backbone of community services provision for individuals with developmental disabilities. It must remain the central vehicle to service delivery to ensure that all individuals have access to quality services, even when they are not the immediate choice of some families under the direct funding model. Okay, you're going to forgive me, OPSEU, for putting it this way, but that's very bureaucratese speak, and I need to know what that means. Professor, you want to tell me what any of that means?
Again, yeah. So I think there's a bit of different views on what the best way forward is. There are some who believe that particular agencies should receive the funding, and those agencies then hire folks like myself that work within those agencies to deliver the services to the community. And then there are other folks who are saying, well, those traditional services may not meet my child's needs exactly. If you're thinking of a sole care provider, for example, and they're working 9 to 5, well, I work only 9 to 5, so I won't be able to provide them with that support, right? So then there are folks who are saying we want to actually have funding so we can use it in ways that are actually relevant to the care needs of our lives. I think Sherry has spoken to that quite a bit. And so I think there needs to be kind of a balance between those two perspectives.
Chris, you want to weigh in on that?
Yeah, I mean, I take exception to that statement. Certainly the first part in terms of agencies having been and continue to be the backbone of supports and services in this sector. But unions have as their central role representing their members. Mm-hmm. And I think that last part of the statement where it says even if families don't want agency supports or the supports through an agency, that's too bad. And I think it doesn't even mention the people being supported. And I just think it trivializes the people whose lives are at stake here and who rely on that kind of support, and it doesn't address their needs at all. So there's plenty of people who are parts of various unions who are very well qualified and do excellent work and provide wonderful supports. And there are others who aren't, who also provide those supports. And I think people, and specifically people who have disabilities, need the opportunity to hire the people that they want to have support them, that they know may be culturally relevant, who have the same holidays, who have the same meal preferences, who relate to, in a culturally appropriate way. If they're working through an agency, they probably don't have that choice. So I just think we need to move more to an individualized approach, and that statement doesn't seem to support that.
Sherry, what did you infer from the statement?
I feel the backbone of supporting people with intellectual disabilities oftentimes is families and oftentimes is mothers. Mm-hmm. And these people need support too, and they need a bit more transparency and flexibility with the funding. So I think giving families the direct funding is important. And the funding will go back into the community. They will hire. They want care. They want. We don't want adult children sitting at home. We want them out. We want them having meaningful lives, and that's what they want to do too.
All right, Marty. Let me ask in our last couple of minutes here the tough question, which is, everybody's coming at government for something, right? Everybody wants government to do more. They want taxes frozen, and they want more services, right? I mean, it's almost an impossibility. So how would you make the case that the group of people you're representing here today deserve their slice of the pie?
I think it's just around really basic humanity, right? It really is that simple. Compassion and humanity. These individuals should not be forced into neglectful situations, which is kind of the conditions that they're living in. Their needs are not met in many different ways, and so I think it's really about challenging ableism and ableist views and really working to break down those. It's not just about building a ramp so that people can get into a building. It's about the idea that we continue to function in a society that continues to devalue folks with disabilities and intellectual disabilities. So there's that huge attitudinal barrier that needs to be challenged. And when we can challenge that, then we can build capacity for understanding why these needs are important.
Well said. That's Martiqua Lampkin. But we call her Marty. That's okay. Yeah. George Brown College, Chris Beasley from Community Living Ontario, Sherry Caldwell, Ontario Disability Coalition. Really good of all three of you to join us here on TVO tonight. Thanks so much.
Thank you so much.
Thanks very much.
And that is the agenda for Tuesday, May 16th, 2023. Is it time for Peel Region to get a divorce and have the constituent parts, Mississauga, Brampton, and Caledon, stand on their own? We'll get some perspectives on that tomorrow. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
With thousands of in-depth interviews and discussions, The Agenda's YouTube channel delivers context for virtually any topic you're interested in. Check out our latest videos and playlists at youtube.com/theagenda. And make sure to hit the subscribe button to get notified about all our new conversations. It's all available at youtube.com/theagenda.